Yo, what's going on? We are back with another episode of the Unsilent Church podcast. We got the original crew up in the building today.
Hey.
You know what I mean? So, it's been a minute since all four of us has been together. Travel and vacations and all sorts of things. But it's good to have everyone back in the studio today. Today we got some interesting conversation that we want to have today. Pastor V, go ahead and start us off.
Yeah, it's good to have everyone back. Especially this is
Johnny calls us all out like he normally does. Taking these routes, it's like testing new intros.
They all know us now, right?
They should know us by now.
That's right. But today we want to talk about. Let me sort of set it up this way. We are all part of different systems, institutions. That affect us, right? That we're part of institution structures that affect us based on the values that they have, the objectives in which they're pursuing. And, I don't want to spend too much time on this, but for some people, that's controversial because I think the Enlightenment has led to radical individualism and people think like, I just do my thing. No, like we are affected by the structures, institutions around us, and they push down on us in particular ways and can have effects. Sometimes in positive ways, sometimes in negative ways. What we want to talk about today is particularly, we can call it the American system, maybe more broadly the Western system, that emphasizes consumption, productivity, power, wealth, all these different things, and how often those objectives, those values have negative effects on disenfranchised groups, the poor, the unseen, the sick. That's just a general thing that we can sort of toss around a little bit, but then pretty quickly I want to zero in on one very sort of particular example. I'm going to call it a case study, but a really important one. Based on that premise, one of the things we do see with the healthcare system is the ways in which it has negative effects on women, and particularly on Black women. That you can really draw a link between certain assumptions that are almost baked in within the healthcare system that affects like all doctors. I've seen it affect it's not as if it only affects like white doctors. I've seen it affect Black doctors as well. There's sort of assumptions based on the healthcare system that has led to some really problematic and bad things to Black women. And the interesting thing here is there's some examples of it doesn't matter if the Black woman is rich or not rich. There's certain assumptions based on based on the system. So that's sort of one particular sort of thing that we'll think about and talk about. But just in general, when I sort of talk about this, how does that strike you? This sort of sense that which we have a culture, a Western culture that is very much about what do we produce? How rich can I get you? We had a bill passed recently, and in America, and I was struck.
Big beautiful bill.
Beautiful bill.
That's what they call it.
And it's interesting how many articles.
Allegedly beautiful.
How many articles I've come across in the newspapers that say, "Well, how much will you save in this bill?" That's all it's about. Like, will you save? Will you not save?
About money.
And if based on your income level, if you make a lot more money, you tend to do better. If you don't make as much, there's less resources. It's different cuts that are happening that are affecting particularly people in rural communities. And so, as we sort of think about this, I mean, I'm just curious in guys' sort of encounters or thought process on sort of the ways in which our systems affect the people who live within those systems.
It's interesting. You said something. You said it's intended to save money, but the last thing that it thinks about is saving lives. And I think it's. That's just the history of our nation. It's lives are like.
That's a bar.
You know what I'm saying? I mean,
can you get rid of the joint on that one?
Yeah, you should get a clue bomb for that.
That's a clue bomb right there.
Yeah, that's something.
It's always the last to be on the table. How can we save lives? I mean, and
because
that's
that goes against saving money.
It does exactly. So then you think about all of these. Yeah.
Wow. No, I'm just amening. Like, that's I got to process that a little bit more because it's like when you said that, the idea of like, saving lives versus saving money, the value that Western society actually has, it's more so for money is their God. And so whatever is going to make a buck, whatever's going to save money, it doesn't care about the other people, like you said, image bearers and that are created in the image of God. It cares about money. And so I was just thinking through just the idea of, someone said, I forget who said it, but the heart is like an idol factory or something.
Calvin, I think, said that.
Yeah. And so
the heart is a perpetual idol making factory, I think.
Yeah. Yeah. And so that idea of like a lot of people, they just care about money. Like that's what they worship.
Yeah.
And I'm just struck by what Jesus said when, in Matthew 6, I believe, where he talks about you can't serve God and money. You know what I mean? And so anyways.
Yeah. I mean, to be clear, I'm not against, people making profit, producing things. I know some people would say, well, were you against societies being successful and doing different things? That's a false dichotomy, right?
I think that's people's issue too, is whenever you call out a thing, you highlight, an issue, like we overvalue, the economy or what economy is. Like you put more emphasis on one thing than the other. And the moment you call out that thing, it's just like, hey, this seems to be a deficiency. This seems to be a problem, a bad habit, a vice. The argument is like, oh, so you don't.
Yeah.
And it's like, that it's funny how that becomes a distraction. And we won't get into like woke DI and all that other stuff, but it seems like that's what becomes a thing. And then it gets used to then reinforce.
Yeah.
But the balance is key here.
Yeah.
And I think we inherently recognize it. It's just we have to sort of call it out and to be able to more clearly then discern what kind of balance do we have. We're all part of families. All of us here have kids. Imagine I led my family driven strictly by output and profit.
Yeah.
I treated sort of my kids that way.
Some do.
Well, some do, right? And you can see the effects on your kids, right? So imagine I'm like, well, this is a splurge for the kids. We're going to save a lot of money as a family if I only give them like oatmeal for breakfast, lunch, and dinner, right? That type of thing, right? Or something like that. Now, again,
Hot cereal.
To be clear, some families can only afford that, but like you see sort of the negative effects of kids who are sort of living in really sort of severe circumstances. Imagine sort of I treated our kids that severely and said the most important thing for a family is that mom and dad make a lot of money and sort of sit on top of that money. Like we don't do that.
Kids are like line items on a balance sheet. Just like, okay, kids have a cost. Let's keep the cost down. Like
no, exactly. We don't do that. I mean, having kids inherently means, there's some things that maybe aren't cost efficient, but they're good for our family.
I agree.
They're beneficial for our family. And so we and all this is balance, right? Is what we're talking about. And so just thinking about that beyond just your individual life, thinking more broadly within our nation, within our world, it's important to ask, okay, so we want to have output, we want to produce, we want to be creative, innovative, et cetera. That's great, but do we have any limits to that? Or there's some things we should not go beyond? How do we balance that with an effort towards dignity, towards care, towards compassion? That sometimes those things, sometimes we should pull back on our output, our productivity, the money we're trying to make because of our desire to maintain really healthy standards of care and compassion for others. That's okay to sort of grace in certain areas, even if that might mean that I don't make as much money and my house isn't worth as much.
I agree with you and everything, but just I can hear, because I know these people that will say, they will push back and say, in some sense, they would argue, family is a business, marriage is a business. And so they look at it in these business type terms. You said, like, even your example, that what you said, there are people that be like, yeah, like that. That's exactly how I look at it. Now we would say that I think that's a problem, but I'm just saying, like,
well, I feel like that's an easy one to counter. Just talk to their kids when they become older and what it felt like to be treated as a product. What it felt like. I mean, we have so many examples. Those kids are in therapists right now. Of kids saying, my dad valued his work more than me.
Yeah, that's true. Yeah, that's true.
Valued his money more than me, and the devastation of that. And there's countless examples of people on their deathbed who made a ton of money and realizing, I wasted my life.
Yeah.
I think there is, because I think our conversation does want to talk through some of the effects of our decisions because of our economy and what that's done in specific places like healthcare and the way we care about,
Yeah.
again, many in our society, again, especially women, Black women, people of color, least of these, like it just keeps going down the line. There is something just about what we're saying where I think one, our definition of business, I think, is distorted. And so I do think there are elements, if we understood what business is in regards to the exchange of value in its most simplest form, that's what business is, trade, right? And so there's always a sense of, now I think it gets distorted very quickly when the trade becomes somebody has to win, somebody has to lose. When that has become, which is sort of again, there are people in business who would say, no, good business means everyone wins.
Win-win, yeah.
Right?
Yeah.
But I think we are in an administration right now when it's winners and losers, us and them. Everything's polarized where now it has to become that. And now you don't have the thought of like, oh no, business is supposed to create opportunity. It's supposed to create health.
What was the definition of business you said again?
It's the exchange of value, trade. That's really it.
Yeah.
Right?
That sounds like a Chat GPT definition.
If you go to ChatGPT and said, explain business in one word, it would say trade.
I knew it. It sounded, I got it.
No, but that's
I nodded. I got it.
That's a common, like, I heard that in school, like economics 101.
No, I agree with
You
it.
just have to keep,
I agree
you
with
just
it.
have to keep pulling it back down. And again, I did
Yeah.
that years ago. I didn't do that this morning. I was just like, okay, hold on. Let me understand something. I go, how would you define business? Now, again, I think there's a guy, his last name's Drucker, where it's like the purpose of business is to provide, is like to increase shareholder value. And that's corporation because people are giving you money. And if they're giving you money, they want their money back and they want a return on that. But it's like, okay, well, explain it in 3 words. Explain it in 2 words. Explain it in 1 word. And it comes down to
Trade.
Everybody knows about bartering. The idea is I have something, you have something. How do we help one another? Right? That gets down to very early, very beginning, very like, even biblical ideas of like, oh, the idea is to be for one another. Yeah, right. So when you're even thinking about economy and even government, and here's the problem with the government, I think our understanding of government is distorted. So when you try to run government like a business, if you understand business as value exchange, that's one thing, because then you're thinking, well, I am a government representing 335 million people. There are a lot of people involved in that. And what's the exchange, right? They're paying taxes. Why? Because we're supposed to provide value to the people under our care. Now, if you don't see government as an institution of care, if you see government as of this idea of like, the kind of like distorted business where there has to be winners and losers, then, and again, within that, and again, with all the layers, now within those, you have parties who are like, well, one has to win, one has to lose. Within those parties, you've got leaders who have to be like, one has to win, one has to lose. Again, when you have layers of that, that's layers of toxicity that then create, again, the kinds of thing that doesn't look at the least of these amongst our society who get affected by the cuts that are intended to say, save money. It's like that kind of economy actually isn't producing what a government is supposed to produce for its people.
So let's zero in on the particular example that we were sort of talked about. I think I want to make sure we have enough time to really sort of draw this out. One particular example of a system is our healthcare system.
Yes.
And arguably, it does. It has some of the same values, which is interesting. The healthcare system is ostensibly about care for people. But underneath that, it is about efficiencies. And hospitals do want to make profit. And they do want to be successful. And there's all sorts of things that sometimes compete against the desire for care. One of the things that's been noted more and more recently, well, actually for a little while now, I think, is how often the healthcare system basically does not work well effectively for Black women, particularly when it comes to maternity. So when you look at maternity mortality rates and healthcare sort of inequities, Black women of color are way more negatively affected than other demographics. So the CDC, there's a stat that we came across. The CDC reports that 50,000 women in the United States suffer from pregnancy complications annually. Black women, however, are at least 3 times more likely to die due to a pregnancy-related cause when compared to white women. And I think that holds true no matter income, if I'm not mistaken. The Black women face higher rates of pregnancy complications. They face that's for pregnancy, but just in general, in terms of care for Black women, there's a lot of things that get missed, that get overlooked. There's a story with Serena Williams.
Yeah.
Serena Williams, I mean, here's a famous athlete, a lot of money, right? She probably had the best medical care. She had emergency C-section, and yet there's a problem, a complication, and her medical team didn't believe her.
Yeah.
And she said, hey, I need you. Fortunately, she was really on top of this. She was more aware of her medical history, and it seems that her medical team was. She's someone who's really afraid of blood clots and was feeling something and said, hey, you need to do these things to check for it. And they're like, well, no, we don't. Maybe you're missing this. They had a lot of doubt about her self-perception. This is sort of, the medical field in general has had problems with this, sometimes not hearing what patients are saying. But it's especially interesting to see how much they don't do it when it comes to women of color and towards black women.
And this is Serena Williams that we're talking about. We're talking about the greatest.
Who has a lot of privilege, a lot of money.
We're talking about the greatest.
And it doesn't matter.
Tennis, you could, male or female, you could probably argue she's the greatest tennis player of all time. You know what I'm saying? Or at least in that conversation.
I want to make this distinction, though. I mean, because when we think about black women, when I think about our history, we have always been a commodity. We've always been...
Yeah, I have a good example of this.
Exactly.
I'll tell you in a second here.
Always been a commodity. And so, I don't know if you were going to talk about the doctor who did those experiment on women.
That's just exactly what I was talking about.
Okay.
So this is, I'll just quickly mention this. Yeah. So James Sims, I don't know if you guys are aware of this. I was shocked when I heard about this. Yeah. It's considered the father of gynecology. He's responsible for sort of beginning of the different tools and techniques that are used to treat women. There's statues of him. I mean, he founded the American Gynecological Society. So all these different things about like him being the father of gynecology. But guess how he developed his techniques into his research?
Butchered.
He experimented on enslaved women without anesthesia, right?
Exactly.
He has one quote of this one woman, an enslaved woman named Lucy, 18, who he worked on for an hour. She said she was screaming in pain for that entire hour. He talked about like how happy he was to always have people he could do his different techniques and experiments on. That's how he delved a lot of his techniques. And what's interesting is he perfected those techniques on enslaved black women who didn't have consent. Their masters brought them, and he did his stuff. As he perfected his techniques, then he moved on to working with white women. But when he got to white women, he used anesthesia for them. Anesthesia was available back then. A lot of people weren't sure about it, but this was a guy who was willing to sort of try different things. It's interesting that he didn't use it when it came to enslaved women, but did use it for white women. One of the reasons why he didn't feel he needed to use anesthesia for black women was he said, well, black women, they can endure pain more.
Absolutely.
And that is something that persists to today. I had something.
Still a thing.
A medical procedure.
Absolutely.
And the doctor sort of assumed that I had a higher pain tolerance just from the jump.
Wow.
Right?
Wow.
I think Kennedy said that like in a Senate hearing about this idea of like black people of color being able to like endure more, withstand more. Again, which they said that before its confirmation, was like, this is dangerous kind of thinking.
Yeah.
Again,
to be saying from leadership.
We're not talking about a lot of these doctors who sort of have this thought. It's not like they're Ku Klux Klan racists,
right.
Don't like, but it's just sort of this thing that's got into the system that black people just couldn't handle more. And so they're less likely to be heard when they're talking about the pain that they have. Doctors will sometimes do certain things and assume like, they'll be fine with it, right? Because of this sort of thing that's in the system. So
yeah. And I don't
so you're right. This has been there for a while.
I think from the genesis of America being America, how we've always treated black bodies, I think that's something that, like, in comparison, I think about, as I was looking at all of these articles and just seeing how women, for me, my own experience has been like, hey, can you do something? And doctors immediately will like decline or like no. My last experience, right, with a doctor, I asked them to do like blood work, simple blood work, but you guys know my history, so obviously that is a trigger for me. And I remember they call me back and they're like, everything's normal. And I'm like, well, that's not what I asked. I'm asking like, what are the levels? Because that will then determine. Right. But it's always this dismissal. It's always this like kind of neglect. But as I was thinking about that too, like our history, of course, and how we treat black bodies, I was thinking about, Eric Gardner came in mind, like, I can't breathe, like all of these different things where we're always crying out like, okay, something is going on with my body. And yet there's people who just disregard that or completely ignore that. And so for black women, obviously, And there are, like, I think about our history, and just for us, as far as epigenetics, have you ever heard of epigenetics? Epigenetics is basically the trauma that stays within your body. So from my grandmother, my mother, all the trauma that they've experienced is
passed
in
down.
their, is passed,
Generational?
exactly. And so you think about all of the stuff that we're like holding in our body, and the things, and what that means as far as like, they said there could be preconditions that happen with women who are having babies, but then there could just be, you know, things that just happen. But I think one of the data, it said, I think we're like 50% or 5 times more likely to experience issues with giving birth, childbirth, either before or after giving birth. And so there's something to be said, and I don't know, and there's not enough studies. That's the other thing that I was going to say, that there's not enough studies that are done, even though we are more highly affected by giving childbirth. And so I think that's just something that we should acknowledge in our system, not just dismiss. It's not something that just came about, but it's always been there.
So a system that just is more oriented towards the particular patients they have, and understanding their stories,
Absolutely,
their history,
Yes.
not just their history now, but even their history in our country, and the different ways in which things can be easily missed, the ways some things do more negatively affect
Yes.
certain population groups, right?
Yeah.
And so there's some things that will affect Black women more than others, and having a system that has ears towards that and is attentive to that, and maybe even makes different decisions based on that.
Yeah. No, here's an interesting, just pulling up some data here. Like there's just a chart when I'm looking at, like, you know, I did a quick like deep research thing on like, hey, what's been the experience over the years, looking at women over the years in healthcare, and even just the report of unfair treatment, 7 times more reports of unfair treatment by Black women than white women. Again, this is not to say white women are mistreated, but the reports, like the reporting, Black women are 7 times more, are reporting 7 times more. Like, hey, I was treated unfairly. Hispanic women twice as much. No, almost 5 times as much.
Okay.
So even just like thinking through that and saying like, hey, are we listening? Are we being,
Or
Yeah.
So
are we listening? But then like gets back into that value conversation.
Right.
Do we
Yes.
actually value women? Like just period. You know what I'm saying? Because it seems as though, do we value lives? And in this context, we're talking about women, but this could be brought up into when you think about
the
this.
vulnerable, right?
Huh?
Anyone who's vulnerable, children, elderly,
Anyone,
Yeah.
who's
Anyone
vulnerable,
who's-
absolutely. But when you think about these situations, you think about the sexual abuse with
Yeah.
women. When you think about the spiritual abuse among, I'm like, it's almost kind of like we don't, as a society, don't really value women as we say that we.
So
do.
as Christians, we want systems that orient towards the values of the kingdom, right?
Absolutely.
Those are values of sympathy, of love, of justice, of truth, of
Gentleness.
care, of gentleness,
Grace.
compassion, right? All these things that sort of orient us towards the other and are willing to extend ourselves towards the other. I mean, obviously, none of us are doctors or administrators or the other things that we can't solve everything. Maybe we'll just sort of think about this particular thing we zeroed on in the healthcare system. I mean, what would it look like? I mean, what might a system look like that cares more for the vulnerable, right? That has that's more aware of the fact that yes, we do want to be profitable, but is willing to check itself. What might that look like? How do you sort of ask those kind of questions more regularly?
Well, one thing,
Maybe it's an open question.
Yeah.
one thing, real quick, I just want to say, like, from my understanding, when you say those different attributes and qualities and stuff about how as Christians, you mentioned, a lot of the hospitals, like churches, started some of these hospitals.
Yeah.
Sure.
For sure.
And so
Absolutely.
it should be baked in almost the DNA and the genesis
Yeah.
of
Well, that's been lost.
care, right?
Yeah.
And so it's almost like, how do we reclaim those things? Because churches started a lot of businesses in hospital,
Yeah.
nonprofits as well, and hospitals is one of them.
yeah. And again, that's why I try to speak back to like, you know, what really is business? You know, when you think like, because I think people use the term business and then start to kind of poo-poo on it because it's like, oh, business, it's all money, it's all this, it's all that. But it's like, well, if you actually think about what it is in its pure form, it's just trade. It's an exchange of value, right? And so when you look at it as a system of care, right, value, outdo one another in honor, then you go, oh, when they started the hospital, like this was the point. And again, if you don't have resources to keep lights on and do whatever, then you don't have anything and nobody can come to anywhere and you don't have the things. But when the thing changes and, economy and metrics and all that stuff becomes the, time per patient and all of that kind of stuff comes in and becomes the standard of care, that's when things become a problem. I do say from a solution standpoint, I do think one of the first things that we have capacity to do is have conversations with Christians who are in those spaces. So if we're talking about healthcare, I'm not in healthcare, but friends and family and those who are in healthcare, understanding better, to say like, hey, in what ways can some of these things be changed, and how and why is it so difficult, that it's not changing? Like, again, we talked about these things, but the mortality rate being like 3 to 4 times higher amongst Black women than other groups. And according to CDC, it's like it shows no significant improvement. So if you go to a health professional and say like, hey, do you experience this? Do you see this? And it's like, hey, if studies show there's no significant improvement, that's like today, 50 years ago, 5 years, 10 years from now, this is still going to be the case. Can you help me understand why this is the case, and what can we do as a body with connected believers all around the world to say, man, is there something you could do on the bedside that might be able to change this little by little, and then that compounds over time?
And I've heard of some places where some of this is changing. They're teaching doctors to ask more questions, to spend more time. Nurse practitioners are becoming really more important, and nurses in general, to really take people's histories and to not immediately doubt what a patient says, particularly when it comes to pain. I think one of the things you're slowly seeing is the medical community recognizing our system does not deal well with recognizing people's pain, addressing it, and responding to it.
Yeah, I was just going to say, you already said it, but that's the first thing, is to believe what people are saying.
Yeah, that's it.
Like, if I'm saying like I'm in pain, don't assume that it's, and make up all of these stories, or create your own narrative.
Just believe it.
Just believe it, and then look into it. And I think also what you're saying is like, get involved in these conversations when it comes to like healthcare. Like, be the advocate in the room to say, hey, these things we can change, we can do better.
Yeah.
Dope. Well, there you have it, folks. Just believe it. Just believe it. That's the one you need to do. That's a solution. First and foremost, to just believe it. You understand me? Hey man, it's good to have everybody back. As
it was pretty heavy. John needed to lighten it up. It's like, yo, let me help y'all laugh a little bit.
Yeah, I'm gonna lighten up a little bit more in a minute. But yeah, listen, as we always say, like, share, comment, do all of that. And just to lighten it up on a note, Pastor V, can you say Chat GPT? Just say it. Can you say it?
Chat GPT.
Oh, okay, good. Because a couple episodes before you was having some trouble.
Oh, I don't remember that. But
Right.
Welcome back, V. God roasting you.
You say so.
All right, man. Like we always say, love God, love people. We are out. Peace.